pleasant day to everyone, especially to our esteemed viewers. We are the group of 3B from the class of 3B. I am Kristen Jade Salas, and together with me are Kyle Brian Pormento, Janette Positos, Johanna Macy San Jose, and Jhasmine Andrea Sese. Today, we are excited and honored to present to you our quantitative correlational research entitled Levels of Spirituality and Spiritual Care Among Nursing Students.
So for a background, irrationality of our study, spirituality distinct from religiosity involves self-awareness, connectedness, and recognition of a higher power. Addressing patients' spiritual needs can enhance resilience and reduce stress, anxiety, and pain. Nurses' own spiritual understanding improves their ability to provide such care, especially across diverse beliefs. These studies aim to determine the spirituality and spiritual care among level 2, 3, and 4 nursing students utilizing a standardized questionnaire for prior studies to prepare future nurses for comprehensive patient-centered care.
Next, for the statement of the problem, the purpose of the study was to determine the levels of spirituality and spiritual care among BSN students enrolled in the BSN program of the academic year 2024 to 2025. Specifically, this study aimed to answer the following questions. First, what is the profile of the participants in terms of sex, religion, and year level? Second, what is the level of spirituality of nursing students when taken as a whole and grouped according to sex, religion, and year level? Third, what is the level of spiritual care of nursing students when taken as a whole and grouped according to sex, religion, and year level? Fourth, is there a significant relationship between the overall level of spirituality of nursing students and the following profile variables, such as sex, religion, and year level? Fifth, is there a significant relationship between the overall level of spiritual care and the following profile variables, such as sex, religion, and year level? And sixth, is there a significant relationship between the overall level of spirituality and overall level of spiritual care of nursing students?
For the significance of the study, this study emphasizes the value of integrating spirituality into nursing education and practice. It can help schools and faculty enhance curricula and teaching methods, support hospitals in improving patient outcomes, and guide students in delivering more holistic, patient-centered care. Ultimately, patients benefit from the more compassionate and spiritually aware nurses, while future researchers can use this as a foundation for deeper exploration in the field.
For the theoretical framework, it utilizes Gene Watson's theory of human caring, as it mainly focuses on the patient care that nurses give and how that care develops into better ways to encourage wellness, fend off sickness, and restore health, and it is composed of 10 critical elements known as caritas. According to the study, the spirituality and ability of nursing students to provide spiritual care not only enhances their nursing profession, but also gives them the ability to successfully fulfill the various requirements of their patients, improving the overall standard of care. As a result, the capacity to offer spiritual care improves the quality of care overall, while also fostering stronger bonds with their patients. So for the conceptual framework, this study centers on the spirituality and spiritual care of nursing students, emphasizing holistic care that addresses the patient's physical, psychological, emotional, social, and spiritual needs. Spirituality in nursing involves concepts such as transcendence, relationships, and a sense of purpose. So this is grounded by the theory of Gene Watson's entitled Theory of Human Caring, along with a profile of the participants such as sex, religion, and year level. So for the hypothesis statement, firstly, there is no significant relationship between nursing students' level of spirituality and their profile variables such as sex, religion, and year level. Second, there is no significant relationship between nursing students' level of spiritual care and their profile variables. And lastly, there is no significant relationship between the overall level of spirituality and the overall level of spiritual care of nursing students.
Next, for our methods, this study aimed to assess the relationship between spirituality and spiritual care among level 2, 3, and 4 BSN students using a quantitative correlational research design. It sought to determine whether a student's level of spirituality influenced their ability to provide spiritual care with variables, including sex, religion, year level, spirituality, and spiritual care. Data were gathered through a survey method using printed questionnaires. So for our participants, the study involved 246 level 2, 3, and 4 nursing students with clinical experience from the academic year 2024 to 2025. Sloven's formula was utilized to determine the sample size using a 5% margin of error. To ensure an accurate distribution, stratified random sampling was used, allocating participants by year level and section after determining the total sample size. So the study used a standardized questionnaire adopted from Chu and Creedy's spiritual caregiving scale. Originally consisting of 68 items, it was reduced to 35 after analysis. The SCGS demonstrated a high reliability with a Cronbach's alpha of 0.96, and stability with validity supported by moderate correlations with related scales. It included 2 sections, which is the demographic profile and survey items. Next, for our statistical treatment, statement of the problem number 1, frequency and percentage to describe demographics, which is sex, religion, and year level. For statement of the problem number 2 and 3, utilized mean and standard deviation to analyze participants' spirituality and spiritual care scores. Statement of the problem number 4 and 5, utilized Spearman rank correlation to examine the relationships of spirituality and spiritual care with sex, religion, and year level. And lastly, statement of the problem number 6, utilized Spearman rank correlation to assess the correlation between spirituality and spiritual care. An independent t-test compared scores by sex, while ANOVA assessed differences across multiple groups, such as religion and year level, offering a deeper understanding of the link between spirituality and spiritual care. So for our ethical consideration, the research proposal was reviewed and approved by the Research Ethics Review Office to ensure adherence to ethical standards. Researchers demonstrated respect for participants by securing informed consent, maintaining voluntary participation, and accommodating participants' availability. Autonomy was prioritized, allowing participants to decline or withdraw without consequences. Confidentiality and anonymity were strictly maintained, with data stored securely and used solely for research purposes. All data collected will be discarded after 3 years to maintain ethical data management. Next, we have table of interpretation. So we have here table 2 is a table of interpretation for spirituality scores, and table 3 is a table of interpretation for spiritual care scores.
Table 4, it shows the demographic profile of the participants such as the sex, religion, and year level. Frequency counts and percentages were used to describe the participation of sex, religion, and year level, providing a demographic overview. Moving on, the Table 5 summarizes the average spirituality scores of nursing students based on sex, religion, and year level. Both male and female students showed high spirituality, and there was no significant difference between Catholic and non-Catholic students. Spirituality scores increase as students advance in the year level, with the highest scores seen in level 4 students. Overall, nursing students demonstrated very high spirituality, which could possibly impact their patient care.
Next, Table 6 showed that nursing students exhibited very high levels of spiritual care across sex, religion, and year level, with level 4 students reporting the highest mean. In relation to this, Brown and other authors found that senior nursing students reported high spiritual care competence and felt well prepared, especially in personalized care and therapeutic presence. Following that, Table 7 showed the relationship between the overall level of spirituality of nursing students and their demographic profile using Spearman rank order correlation. Results indicated no significant relationship between spirituality and sex or religion, but a significant relationship between spirituality and year level. A positive correlation between spirituality and year level suggests that nursing students become more spiritual as they progress, aligning with Ansel and Osel's finding that fourth-year students had higher spirituality than third-year students.
So for Table 8, it showed no significant relationship between students' spiritual care and sex, religion, or year level, indicating consistent levels of spiritual care across these demographics using the Spearman rank order correlation. So this aligns with the study of Pepkins, where the demographic factors did not affect the nursing students' understanding of spirituality in nursing practice, particularly the difference between the year level. So for the succeeding table, it showed a strong, positive, and significant correlation between spirituality and spiritual care among nursing students, indicating that higher levels of spirituality were associated with greater ability to provide spiritual care. Results were acquired through Spearman rank correlation as well. So this outcome aligned with the study of Withrop, where nurses' values and spirituality significantly correlate with their confidence in providing spiritual care.
So in conclusion, our findings showed that the levels 2, 3, and 4 nursing students consistently demonstrated high levels of spirituality and spiritual care regardless of their sex, religion, or year level. There is a strong positive correlation between the two, suggesting that as students grow in their academic and clinical journey, so does their spiritual maturity. This highlights how inner development plays a key role in compassionate, holistic nursing care.
So for our recommendation, the study suggests that nursing curricula integrate spirituality through experiential learning, while healthcare institutions support spiritual care environments. Nursing faculty should include spiritual care objectives in clinical instruction, and students should practice self-reflection to enhance spiritual sensitivity. Future research should focus on interventions to improve spiritual care skills and assess the long-term impact on patient outcomes.
For the utilization, we aim to share these results with nursing schools, healthcare institutions, and organizations to help shape spiritually grounded education and training. The data will also be published online to inspire further research and remind us all that nursing isn't just a profession, it's a spiritual calling to care for both body and soul. For our acknowledgement, we extend our heartfelt gratitude to our God Almighty for His guidance, to our families and friends for their unwavering support, to our professors and panelists for their wisdom and feedback, to our participants for sharing their time and experiences, and overall to the College of Nursing for providing the resources that made this study possible. And that concludes our presentation. We hope that we've inspired a deeper appreciation for the role of spirituality in nursing care. Thank you for joining us, and may you have a joyful, meaningful day ahead.